The European Union is recording the most new COVID-19 cases since the start of the pandemic. In response, some European countries are issuing lockdowns and travel restrictions. Austria is under a nationwide lockdown to curb the latest wave. The country has seen nearly 2 weeks of record-breaking case numbers. Hard-hit regions in Germany are facing local shutdowns of public spaces as hospital beds fill up. The U.S. has declared level 4 travel advisories for Germany and Denmark. The State Department is warning Americans not to travel to those countries because of the health risks. For more on all of this, I want to bring in CBS News foreign correspondent Charlie D'Agata. He joins me now from London. Hi, Charlie. Great to see you. So how are hospitals handling this recent surge in cases in Europe?
Well, Tanya, you and I never speak when it's good news, which is a shame. But this,
I agree.
And I'm always careful about covering these pan-Europe stories because they seem alarmist and they over-exaggerate. And, you know, Europe is a big place with several countries in it. But things are bad. They're as bad as they've ever been in terms of case numbers. I mean, when I say ever been, not just this time around, ever since this pandemic began. The numbers in Austria, the numbers in Germany, the Netherlands, in Eastern Europe, which they believe those numbers are being underreported. So when you talk about whether the hospital beds are filling up, they are filling up already. And the reason for these extraordinary lockdowns, I mean, unprecedented. I hate using that word, but this one actually applies in this case. Austria declaring this is the first lockdown of this fourth wave, if we're keeping count. And then the first Western democracy to make vaccinations compulsory over the age of 18 by February 1st. I mean, these are uncharted waters. And as you said, Germany may be following suit. In fact, I would guess that it's likely that they will because these numbers are just going insane. And we always want to follow trends. And it's the trends that are worrying health ministers in the EU, in Europe, because they're all pointing upwards. There isn't any set leveling off there. And using Germany's health minister's words, he says, by the end of this winter, everyone in Germany will be vaccinated, recovered, or dead.
Oh, that's so extreme. So what's going on in these countries that are seeing the most cases? Are these countries that have lower vaccination rates? Are there any generalizations we can make about those countries?
Yes, and Tanya, this is the reason we try to steer clear of generalizations because every country is different. Yep. But let's just take a look at Austria and the reason that they're putting these really strict new lockdown measures in place. I have to kind of back it up a little bit because for the past couple of weeks, there was kind of a two-tiered system. So I wouldn't go far as to call it a vaccine passport, although in essence, that is what it is. If you show you've got a vaccine, you're allowed into places. If you don't have that vaccine, then you're not allowed. So they were already sort of restricting. There was a lockdown for the unvaccinated, in their words. But it's because there's a direct correlation. When you look at Austria specifically, the reason that they have this as the epicenter, it has one of the lowest vaccination uptakes in Europe, certainly the lowest in Western Europe, but it has one of the highest infection rates, 5 times higher than the United States. So we're not playing around here. I mean, these are serious numbers, and these are the reasons that the governments now, I mean, and we're coming into the winter months. You know, there's always a pressure on health systems and hospitals in the winter months, and they're just trying to defend, I guess, hospital workers, the hospitals themselves, the hospital beds, in order to try to keep the numbers down as quickly as they can. And of course, the message is not only get your vaccines, but get your boosters. I mean, here in the UK, for instance, they don't believe, again, following the trends, when you see the spikes, it's not spiking, it's sort of leveling off. As a matter of fact, it's come down a little bit. Why? There are those who suggest that the Delta wave had hit here a couple of months ago. Remember, it was first here, it was first identified here, starting to level off. Big vaccination uptake here and big booster uptake here. And we're not having a lockdown so far. We don't know what the future is going to bring.
So just, again, not to generalize, but looking at the countries that seem to be the hardest hit right now, they tend to be a little bit of the northern European countries, right? So is this weather related? Are we going to see that trickle down to, you know, the southern European countries as the months go on? Or, like, how is Italy doing, for instance?
Well, it certainly seems weather-related, and the reason is people are spending more time indoors. They're not wearing masks. They're closer to one another. It's damp. It's cold. In the same way that you find, and I'm not an expert on COVID. I just report what other people are reporting. But these are where you see the trends, as you pointed out. Yes, in the colder areas, the colder climates, in places like where I just got back from, in Poland, in Eastern Germany, Austria, their numbers are going up. However, in Italy, places like Portugal, those numbers have either flatlined or they're going down. Now, can it be argued, well, they're warmer countries, not as many people are going inside? Yes, to a degree. However, both Portugal and Italy also have extremely high, and I use that word correctly, accurately, relatively speaking to the rest of Europe, extremely high vaccination uptakes in places like Portugal, which is really a standout globally, as a matter of fact, and Italy, so shining examples of that. But you only have to look at a map and see the red areas and see the sort of less red areas, I suppose, or green areas to draw the correlation between as it gets colder, as we head into these winter months, because people are gathered in closer together. They're not in open spaces. They're not wearing masks. They're not doing all the stuff that we've been told to do for the past 18 months, 2 years. This is where you're seeing the infection rates rise.
Right. Absolutely. And you know, just to pivot a bit, you know, Charlie, you've been covering the border crisis along the Poland-Belarus border. How has the migrant situation there, you know, affected the COVID situation? Have there been any outbreaks in those camps there along the border?
Well, I mean, it's multi-layered, isn't it?
Yeah.
There are complexities. First of all, Belarus has it's underreported. I think they believe themselves it's being underreported, as a high concentration of COVID there. Where we went, and we hadn't known this, we were just covering the border crisis, as you said. We learned that along that eastern border in Poland, they have one of the highest infection rates. So that was already a perfect storm. And then when you enter the migrants coming in, and there are 20,000 of them, in these just horrendous conditions. I mean, it is freezing cold there, I can tell you as an eyewitness, and they're all packed together. You can see from those pictures, there aren't many masks there. You know, COVID isn't really high on their priority list when they're trying to escape from a war-torn country and get to another place. So, of course, there have been outbreaks. And just anecdotally, we spoke to a woman who had just come across from Belarus into Poland, and she suffered a miscarriage. And that was terrible. And she was found in the woods by these aid workers, separated from her husband and her 4 children. And guess what? She was also suffering from COVID. As a matter of fact, that's what they identified, because she was very unwell, took her to the hospital, and then the rest of that unfolded. So yes, this is complicating an already horrendous situation there.
Tragedy compounding tragedy. All right. Well, Charlie D'Agata in London, thank you so much. We appreciate your reporting.